So coming to the tubular secretion, right? So we have discussed that the excretion of the drug majoritarily it occurs through the kidney, and within the kidney it occurs by the glomerular filtration, and it occurs by tubular reabsorption, and then it occurs by tubular secretion. Now we have already discussed about the glomerular filtration and tubular reabsorption. So glomerular filtration, we have discussed that the filtration of the drug, it depends upon the plasma protein binding capacity, and tubular reabsorption, if we see, we have discussed that it depends upon the lipid solubility. Whereas you take the tubular secretion, remember, if the drug has to be secreted across the tubule, the tubular secretion does not depend on either the lipid solubility or the plasma protein binding capacity. Alright, so tubular secretion, remember, it does not depend on it does not depend on lipid solubility, right? It does not depend on the lipid solubility or does not depend on the plasma protein binding. Right, does not depend on the plasma protein binding of the drug. Now you see here in the nephron, like there are separate pumps which are present for the acidic drugs and as well as for the basic drugs, right? So in the nephron, remember this point, there are separate pumps for the excretion of the basic drugs and for the excretion of the acidic drugs, right? Separate pumps for the excretion of the acidic drugs and for the excretion of the basic drugs. Now you take the drugs utilizing the same transporter. Let me tell you one example here. Now drugs utilizing the same transporter may show the drug interaction, right? Let me tell you an example of this. So drugs utilizing the same transporter, right? Drugs utilizing the same transporter, they show the drug interactions. Right? They show the drug interactions. Now let me tell you an example for this. Now you take, this is the Bowman's capsule, and continuation of this will be your proximal convoluted tubule, and then you have the loop of Henle, then distal convoluted tubule, collecting duct, and as well as the collecting tubule. You take in the proximal convoluted tubule, like we have a transporter for the uric acid, right? We have a transporter for the uric acid. So this particular transporter, remember, it will increase the secretion of the uric acid, right? It will increase the secretion of the uric acid. That is what is the function of this particular transporter. Is that clear? Now remember, the drug which competes with this transporter is your penicillin. So drug utilizing the same transporter may show drug interaction. Example, you take the probenecid, right? You take the penicillin. You take penicillin, probenecid, and uric acid. Okay, so probenecid, penicillin, and uric acid. Okay, and uric acid. Now, what is the story of these three? Remember, probenecid, right? Probenecid will decrease the excretion of the penicillin and increase the excretion of the uric acid. probenecid, what it will do? It will decrease, right? It will decrease the excretion of penicillin, whereas probenecid, it will increase the excretion of the uric acid. That means what I want to tell you here is uric acid and as well as penicillin, right? Uric acid and as well as penicillin, they try to get secreted through the same transporter, right? They try to get secreted through the same transporter in the proximal convoluted tubule. Now, whenever you are giving penicillin, for suppose you are giving probenecid, right? For suppose you are giving probenecid, what this particular probenecid will do is probenecid will decrease the excretion of the penicillin. That means the probenecid will decrease the secretion of the penicillin, thereby decreasing the excretion. But what the probenecid will do? Probenecid will increase the secretion of the uric acid and increase the excretion of the uric acid. Okay, so exogenous compounds, right? Exogenous compounds like penicillins, they are excreted, right? They are excreted, whereas you take the endogenous compounds, right? You take the endogenous compounds like uric acid, that will be retained. So what I want to tell you here is, you take this particular probenecid. Probenecid is given as a part of the treatment in case of hyperuricemia. Why? Because the probenecid increases the excretion of the uric acid. And which is that particular clinical condition where you have hyperuricemia? That is nothing but your gouty arthritis. In gouty arthritis or gout, there is increase in the uric acid level. In that clinical scenario, if you give probenecid, probenecid will increase the secretion of the uric acid and it will increase the excretion of the uric acid. So this is about the excretion, right? So we have discussed glomerular filtration, tubular reabsorption and tubular secretion. So tubular secretion does not depend upon the lipid solubility or the plasma protein binding capacity. In the nephrons, there are separate pumps for the basic drugs and as well as the acidic drugs. And the drugs where they use the same transporters, like they have drug interactions. Now the example says the probenecid, penicillin and as well as the uric acid. Now what your probenecid will do is, probenecid will decrease the excretion of the penicillin, whereas probenecid will increase the excretion of the uric acid. So remember, the exogenous substances examples penicillins are removed, whereas the endogenous substances like uric acid are retained by this particular pump.